Hello and welcome to Exam Technique Screencast. The key focus of this is going to be on adaptations to training. Now, if you've listened to any previous screencasts, you'll kind of have an understanding that any adaptations to training are extremely likely within the exam for a number of reasons. Firstly, aerobic adaptations and strength adaptations have a huge chance of being kind of part two, or certainly part of part two, of a synoptic 20-mark question. Therefore, I feel like right towards the exam, it's very difficult now at this point for me to teach you, allow you to learn or memorize adaptations. You should know those by now. What I'm going to do is just use some information we've got very recently from the AS exam to ensure that your exam technique is right on point when answering questions on the link to adaptations. Now, let me make this clear before I go into any of this information. If you had a 20-mark question that said to you, I don't know, part one was we looked at anaerobic energy systems, then a period of strength training, and then strength adaptations. If it asked you in part of a 20-mark question, it will be asking you about all of the physiological adaptations. If it was the aerobic adaptations in part two of a kind of aerobic energy system, aerobic training program, and then aerobic adaptation, you talk about all of the aerobic adaptations. However, the 2019 AS exam, in the smaller questions, asked for people to categorise or have an understanding of the categorisation of the different kind of adaptations. So it's really important that we just have a quick look that you have an understanding. The majority of you will be really good at using memory hooks to kind of regurgitate or kind of certainly apply the aerobic adaptations. So it's just important to make sure that when you see those adaptations, when you're revising them, just as a last little kind of a check-off point, that you have an understanding that within those, this was a task you were asked to do for Easter to make sure you know the difference between metabolic, muscular, cardiovascular, and respiratory. That's the first thing. And the second thing that I just ask you to consider, and I'd rather you just consider this the day before the exam than have to consider it under pressure in an exam hall. So the thing I just also ask you to do, in 15 years of teaching, I've never ever seen a command word evaluate with regard to aerobic adaptations. But what I'm going to ask you to do, just in preparation for this exam, to ensure that if you were asked to evaluate, that you had an understanding of how you could apply the assessment objective 3 command word evaluate to aerobic adaptations. So the way you would have to do this would be linked to a scenario. Now, they put this in an AS paper for 4 marks, this question, horrendous question for a year 1 paper, and, I think it's very unlikely you're going to get it, but it's just so that you would have an understanding of what to do if it did come out. So if you look at this question, aerobic capacity is an important fitness component for team game players. That is a hugely important circle or highlight within the exam question. It then asks you to evaluate the benefit of different physiological adaptations, and this is where it gets tricky, made by the muscular and metabolic systems. So straight away, you've got a 4-mark question. I didn't have space to put the 4 on there. It's asking for muscular and metabolic, okay, and the command word is evaluate. Now, like it's 15 years of seeing these exam questions come up. Every single time a question on adaptations, as it did last year's AS, as it did with last year's flexibility, it just asks you to explain it. But as they're trying to make things difficult in this exam, it seems, or the AS exam they put evaluate. So straight away, it's a little bit contradictory at first glance, because you think, well, adaptations to aerobic training are beneficial, therefore they're positives. So we know the evaluate command word refers to positives and negatives, or strengths and weaknesses. So what we have to do here is 2 things, really. Firstly, have an understanding of muscular and metabolic adaptations within aerobic adaptations. Secondly, we have to try and consider how we would give a strength and a weakness of these adaptations. Now, the key to this is using the kind of scenario of a team game player. If they put a scenario in the question, they are asking you, they are virtually telling you, you need to reference that at some point. So what do we need for this? So first, we'll have a look at making sure we can categorize them in a second. But if I just give you a quick example of how we'd apply this to a muscular adaptation. So a muscular adaptation to aerobic training, okay, would be an example of myoglobin stores. You could have had mitochondrial density. You could have had other ones. Ultimately, if you've been taught by me, these are the 2 that you would have focused on for muscular. So if that's the case, then the strength of this is that it increases O2 transport, which means a games player, if you were using football as an example, could last for 90 minutes. The weakness of it is the only way I can think of going about this is that there's a minimal effect on anaerobic actions such as jumping for a header, so it's not going to improve anaerobic performance. Now, horrendous question for 4 marks, but I thought it was really important just to think if you did get the command word evaluate, the amount of the adaptations in a part 2 of a 20-mark question, it'd be really good for you to just see this now and be able to act on it now and just have a think about it rather than being put in that horrible situation of seeing something you've never seen before, as I was when I saw this paper from AS. The good thing is you didn't sit the AS exams, therefore let's use it to our benefit, and if it does come up we can apply our knowledge to that. Now, we'll have a look at these 2 things in a second. If we look at strength adaptations, key things we need to have a look at here then is, again, we just need to make sure, just brush up, just make sure you can categorise them into neural, metabolic and muscular in the worst case scenario. Last summer, I need to make this very clear, last summer the question for AS was describe a 1 strength endurance weight training program. Part 2 of that question for 4 marks was describe the physiological adaptations that would take place after a period of kind of strength endurance training. Now, they did not require categorising, but I just think pretty much everyone, would feel comfortable with strength adaptations. Now, just a little bit, just a little touch, just to think, right, could I categorise them if I absolutely had to? Okay, in the worst case scenario, I think you'd rather just feel like, spend kind of 3 minutes, 2 minutes just thinking, right, oh yeah, that's fine. Okay, so that's what I do with strength adaptations. Now, on top of that, of course, we might need to link it to sporting examples of how it might improve performance, which I think is a little bit more straightforward. And then finally, for flexibility adaptations, we need to just consider and make sure we can apply flexibility adaptations to performance in sport. And there's an example of that from the AS exam just recently, last Friday, from that. So I thought it'd be nice just to kind of make sure that if something came up like that, we could do it. And it's just exam technique. This is not a learning screencast. I'm not asking you to memorize or be able to learn adaptations. You should have learned them by now. It's just making sure we can tidy up and make sure that with the modern exam, with the new specification, they are trying to catch you out. So let's try and make sure that we kind of beat them to that. So, aerobic adaptations to training, I put the hooks down here that we'd use to remember them, and they would translate into these kind of adaptations. Now, what I'd ask you to just consider now, obviously these are adaptations, the net effect of these adaptations, and the key things associated with all aerobic training is the fact we have an increased VO2 max, increased intensity and duration of performance before fatigue, delayed point of oblo, which means we can work harder for longer, and that's our kind of net effect of all of these. And of course, to use all of these, if you used them like this, if it was a 20-mark question that asked you kind of the aerobic adaptations to a training program, then this is when you would not need any categorization. However, as we just saw, if it's a short question and they're trying to catch people out, or they're trying to discriminate and really see who actually knows the categories for adaptation, it's important we can do that. So you might want to pause the screencast now, just check and see if you could categorize each of these into the kind of 4 areas. Okay. Right, so look then. So you should have had them something like this. So you should have had them into cardiovascular there. So you've got cardiac hypertrophy, anything to do with cardio or vascular. So you've got cardiac hypertrophy, red blood cell production, blood, vascular, decreased blood viscosity, vascular, capillarization, vascular, blood, capillaries, vascular shunt, vascular, and then obviously you could link that to the elasticity of the arterioles or arteries during exercise. So they're the kind of things in there. Muscular, we use our 2 M's, mitochondrial density, myoglobin stores. There are others, but that's the ones we focused on. Respiratory, okay, so we're looking at this idea of the surface area of the alveoli, and as a result, also you've got increased lung volumes. I missed one out here. Could you please make sure you add that in? You would also have increased efficiency of the mechanics of breathing. So can you add that to that, please? I haven't put that one in there for some reason. And then on top of that, you've got metabolic. So metabolic, looking at this idea of fuels and enzymes that break down the fuels, okay, alongside buffering capacity. So that's worth making sure you get that in the right place. So that'd be the categorizing for aerobic adaptations. Just making sure you know the slight difference between them quite easily. Cardiovascular, absolutely straightforward. Muscular, straightforward. Respiratory, straightforward. Metabolic, just are the leftovers really, things that allows us to metabolize fuels during kind of aerobic energy production. Okay. Flexibility then. So we've got flexibility training here. So in terms of kind of our adaptations, they are down here. In terms of memory and memorizing them, you would use the acronym to get flexibility training. You would need to do stretch, and that will give you the key adaptations for those. Now, if we have a look at this, I said to you the key exam technique point here will be linked to this question. So the question came up in the AS paper, very random one, but the kind of the exam technique is quite nice for us to use. Command word, explain, nice and easy. Once we've got the explain, it then asks us to kind of apply them to a sporting activity of your choice. So if this is going to be popular with any of the adaptations, I suppose, with regard to a 20-mark question, because it allows you to demonstrate assessment objective 2. Application to examples. So I've just put a couple in here just as examples. Your stretch reflex inhibited by muscle spindles. So that means that you can maybe move, a goalkeeper can stretch further, can move the shoulder further back in order to save a shot. If you look at range of movement at a joint, a football player, if you wanted to use a goalkeeper or rugby player, whatever you want to use, pick anything, link it to your own sport. They could get a greater backswing before kicking a ball, which means they could kick it further. And then finally, you have this idea here, a reduced antagonist inhibition is reduced. So give an example of maybe where in your sport it could be a goalkeeper's bicep brachii and tricep brachii working together when reaching up to punch a ball as a result of flexibility training at the elbow. You could be using things such as the rectus femoris or bicep femoris working together for a netballer and jumping up off the floor as a result of kind of flexibility training. Things like this, just making sure you have an idea that they can work together as a result of it as an extra adaptation. So that was just there, just making sure. At the end of the day, it's common sense, really, isn't it? It's just making sure that you can dissect a couple of these examples, these adaptations, if asked, and give examples on how they improve the performance of the scenario in the exam question. Now, if we go on then, adaptations to strength training. So as you will know by now, strength training, when we use this, we use the acronym of strength. Okay, so bearing in mind a couple of key exam points before I move on. When you're talking using strength as an acronym, you must remember that synchronization and recruitment come under one adaptation. So they become a sentence: increased synchronization and an increased recruitment of type 2B motor units or fast glycolytic 2B motor units. Now, on top of this, it's just worth remembering that by doing these, they increase the force of contraction. On top of this, then, it's just that there's a couple of examples. Just want to hyperplasia and hypertrophy are separate adaptation points. You get separate credit for those of the 2A, 2B fibers. Now, if that is your kind of response there, then key things for us to do. Do we know the difference between muscular, metabolic, and neural adaptations to strength training? Now, you should be able to use your knowledge of aerobic adaptations for these, but there's a couple, obviously. Neural or new. Which out of these adaptations does the brain switch on in order for them to be able to be effective? So we've got neural here. Synchronization and recruitment at 2B motor units with talus, due to the impulse coming from the central nervous system in the brain, that will be neural. And then inhibition, decreased of the stretch reflex. Okay, so the thing we talked about there, that is a neural adaptation. Now, if we go on top of that, have a look at metabolic into here then. So you get a buffering capacity as we looked at previously, and then obviously our fuels and enzymes, nice easy ones to put in there. And of course, the two muscular hypertrophy, hyperplasia will come under these. So just a quick point, just to make sure we can have a look at that. Final thing then, I wanted to say, if you had to give examples linked to strength training, these are some examples you could use for the neural ones. If you wanted to be really specific, you could do that. You could use this with regard to anaerobic threshold or buffering capacity, and you could do this for kind of hypertrophy, hyperplasia, allows an increased power in the shoulder bar. So I just want to get onto this before the screencast finishes. So this was our example of a 20-mark question. You've used this throughout the revision period, and part 2. If they decided to say, rather than, and it was linked to a football player or a netball player, whatever, if they changed the command word, which they could, okay, and they decided to put the assessment objective 3 here, evaluate the benefits of physiological adaptations after a period of plyometric training for the footballer, When we're talking about this, of course, football is anaerobic. So although you get the anaerobic adaptations from strength, you could criticise it by saying they would not allow a fused aerobic capacity due to not last a 90-minute game, and I'll let you read those.